Dr. Stan Yates, board-certified obstetrician and gynecologist. I've been involved in women's health care for over 30 years. I've met a lot of couples who want to have families. There's a common misunderstanding that ovulation always occurs on day 14 of the woman's menstrual cycle. That may be true for some women, but not all. Women who have a shorter or longer menstrual cycle than 28 days could easily miss their most fertile time to conceive. The missed opportunity leads to frustration. Today, I would like to shed some light on the subject for your success. Debunking common misconceptions about ovulation, what you should know. Every woman does not have to experience a perfect 28-day menstrual cycle to ovulate. There's a normal range of a menstrual cycle, which varies from 21 days to 35 days. Any variation within this range is considered normal for the individual. The difference in cycle length alters the day of ovulation, so it's important to recognize that your fertile window may be different from your relative and your friend. When ovulation occurs, the egg can be viable for 12 to 24 hours. Sperm can survive in the woman's reproductive organs for up to 5 days. This means your fertile window can be as much as 6 days, more than the 24 hours linked to ovulation. The beginning of your fertile window is unique to you and depends on your individual cycle trend. Here's a common misunderstanding about ovarian reserve. Some women are under the impression that they should avoid pregnancy in their later 30s and 40s because their egg quality is poor. And it is true that egg quantity go down with age. It is also true that problems with gestational diabetes may be more common later in life. However, I've cared for many women in this age group who did well in pregnancy and subsequently delivered many beautiful and healthy babies for their family. Though you may need medical assistance in this journey, it's okay for you to follow your heart for the dream of parenthood. Well, let's talk about lifestyle factors and how they influence your fertility journey. Good nutrition always contributes positively to your health. A balanced Mediterranean diet can improve your chances of conception. Now, I'm not saying that diet alone can guarantee pregnancy, but it plays a crucial role in creating a favorable environment for good health and conception. Consider incorporating supplements like folic acid, magnesium, or foods rich in omega-3 fatty acids into your daily routine to support hormone balance and fertility. Research suggests that supplements may play a beneficial role in supporting reproductive health. Regular exercise also is a good means to stay healthy. Moderate exercise can help hormonal balance, which could improve ovulation potential. Exercise also reduces stress, which can easily interfere with hormone balance. For example, activities like walking, yoga, and swimming are good options for you to consider. Not only will these exercises improve your overall health, but they'll also help stress levels to reduce. Chronic stress can suppress ovulation, making it more difficult to conceive. Another lifestyle factor to consider is sleep quality. Getting 7 to 8 hours of sleep each night is beneficial for regulating your hormones and supporting reproductive health. Establish a relaxing bedtime routine to promote better sleep. Most of us should avoid screens on our devices or TV for at least 30 minutes before bedtime. During reproductive age, a woman's body goes through a hormonal process to ovulate each month. Follicle-stimulating hormone, or FSH, initially starts the process by stimulating follicle growth in your ovaries. These follicles are little cysts that contain eggs which are ready to be fertilized when mature. As the follicle grows, its outer layer secretes a hormone called estradiol, which is a form of estrogen. Once the estradiol levels become high enough, they trigger the release of luteinizing hormone, or LH, which signals the release of the most mature egg. Usually, one egg is released. When 2 or more eggs are released, that's when twins can be conceived. This hormone LH is measured by the over-the-counter ovulation predictor kit. Ovulation predictor kits are available at most drugstores. They test for LH in the urine. The kits vary in length of testing from 5 to 10 days. The LH surge can be monitored to determine the trend of your ovulation timing. There are several means to check for ovulation. Besides the luteinizing hormone surge, there are other signs of your fertile window. Some women experience Mittelschmerz at the time of ovulation. Of course, severe pain needs proper medical evaluation. For tracking ovulation, I suggest combining methods. Use both basal body temperature charting and LH testing. It may require more effort, but it is a good way to correlate the anticipated ovulation time. Physical signs such as cervical mucus changes and mid-cycle ovulation pain, known as Mittelschmerz, can also suggest your estimation is accurate. Timing is crucial. Once you have determined the likely day of ovulation, consider beginning your fertile window as 5 days before ovulation. As you consider the 6 days of your fertile window, try it every other day from the beginning of your fertile window. The 24 hours after the day of ovulation is especially important. Communication with dad is important for your relationship and your goal. The dream to have a child is a shared dream. Openly discussing your fertility journey and fortifying your relationship can alleviate stress and anxiety. Then fertility is optimized. Schedule regular date night. Prioritize quality time together as a couple to strengthen your bond. If you're planning pregnancy, start tracking your cycle using multiple methods that we have discussed earlier. If you're 35 years old or younger and you've been trying to get pregnant for 12 months without success, please schedule a consultation with a reproductive health professional. If you're over 35 years of age and have tried for 6 months without success, it's reasonable to seek this consultation sooner. Early intervention can make a significant difference. Join online community forums or groups focused on fertility to connect with others who understand your journey. Moms in the Making is a fantastic group of women who understand the challenging journey to get pregnant. Sharing experiences, knowledge, and support can make a significant difference during this process. At Stork Advisor, we believe that informed women are prepared for success on their journey to motherhood. Every woman's fertility journey is unique. Education and perseverance are key components to your success. Our dream is your dream becomes a reality. I'm Dr. Stan. Thanks for joining me today.